The challenge: to offer quality health care to the uninsured who are at or below the poverty level without relying on government agencies or government assistance. In a state like Virginia, deeply ingrained in the concept of self-reliance and limited government, the answer came from a group of concerned citizens in Winchester.
We saw the need for helping out we called it the working poor. They had absolutely no insurance. We were not looking for Medicaid nor Medicare patients either. They had to meet the poverty level in the state of Virginia or the government.
The clinic began in 1986 and was housed one night a week in the basement of the Presbyterian Church and staffed entirely by volunteers. Through active community support, from donations and fundraising events, the clinic has been able to expand with its growing clientele, and the need continues to grow.
Right now in our catchment area, there are approximately 122,000 people that live here, and about 25,000 of them don't have health insurance.
I started here as a student in 2005, and I began working here as an assistant nurse practitioner in 2006. And one of the things I noticed right away was how complex the patients were with their disease processes. I think the reason for this is that most of the people that come to the free clinic have not had medical care of any regular type for years and years. Some of them never, not even as a child. And by the time they get to us, their symptoms are so bothersome or so burdensome that they have either gone to the emergency room way too many times trying to seek management of their chronic issues, or they have symptoms that they can't stand anymore and they come to us for care. Over the years, both the numbers of patients and the complexity of patients seems to have grown and grown.
The Winchester Free Medical Clinic is dedicated to the belief that everyone should have access to health care services, and that it should be done in the most cost-conscious and cost-effective way. And this includes new, innovative initiatives to treat and educate patients to minimize future ailments.
In terms of future direction for the free clinic, we will be introducing services like physical therapy and occupational therapy, expanding our mental health clinic, and looking to do more events in the community. For example, our Project First, which is a free risk factor screening event at key areas in the community, screening for things like diabetes and high blood pressure. We're also looking at launching a community-based disease management initiative. So really expanding our services from our four walls here in the clinic and meeting patients where they are at in the community in the not too distant future.
I want to be able to increase the diversity of patients in that they're not all in their 40s and 50s, and as they say, I feel like I'm falling apart, to the point where maybe the disease process is it's a little too late to intervene and really turn it around. I would like to see people in their 30s and their 20s come in. And they may not have to come in that often, but we can do their basic labs. We can do a really good exam. And to catch things way before they turn into an irreversible condition that's going to ruin their middle age and their old age and cost them their ability to become productive members of society again. I really started this job because I want to help people get healthy. I want to get things turned around. I want to help them. I want them to become productive again and happier than they were. I'm not going to promote just getting disability and living as you have always lived. That is not our goal here at the Free Clinic.
The Winchester Free Clinic was founded on the belief that citizens help citizens. The clinic is community-sustained, with 90% of its operating budget coming from individual support, and with no funding from federal government. You can make a direct impact on the health of your community and know that your dollars are being spent in your community on the people in the most need. Give today and help support the new breed of community-funded healthcare.